Diabetic retinopathy is a disease that affects patients with diabetes. In diabetic retinopathy, there are changes to the blood vessels that line the retina, the nerve tissue lining of the back of the eye. Diabetic retinopathy is one of the most common reasons why patients of a younger age may lose vision. Patients may notice either blurring of their vision, distortion of their vision, or lots of floaters in their vision. What's very important to know is that some patients may have very few symptoms but still have very severe diabetes. And that's why all patients who have diabetes will require regular screening of their eyes to look for diabetic retinopathy. In its very severe form, diabetic retinopathy can unfortunately cause blindness. Diabetic retinopathy can affect anybody with diabetes, but it's more common in patients who have uncontrolled diabetes with very high sugars, and it's also more common in patients who have had diabetes for a long period of time. The other major risk factor is blood pressure, which compounds the effect of poor diabetic control. In terms of treating diabetes, we have to treat both the underlying cause as well as treat the eye. So treating the underlying cause is mainly treating the diabetes, and this is in conjunction with your general practitioner or your endocrinologist. But it's also important to treat the blood pressure and to treat any high cholesterol. It's important to stop smoking if you're currently smoking, to exercise, and to have a healthy diet. Treating eyes with diabetes depends on the cause of vision loss. So there are two main causes of vision loss in diabetes. The first is swelling of the retina, in particular the center of the retina, called the macula. And that's a condition that we call macular edema. The main way we treat macular edema is with medications that are given into the eye. There are two main groups of medications, the first being a group called the anti-VEGF or VEGF therapies, and the second being steroids. It's important that these medications are given on a regular basis. Often they have to be given monthly initially. Sometimes they can be given less frequently with time if the eye responds well, and sometimes these treatments can even be stopped. The other main cause of vision loss is what we call proliferative disease, where there are abnormal blood vessels that bleed and burst in the back of the eye. Treatment of this may include laser, injections of medication into the eye, or even surgery. It's important to note that although medications or injections in the eye are often used, and these sound scary at first, they are actually painless because we numb the eye beforehand. So many patients feel a lot more relieved after their first treatment.